This is Dave coming to you today with some information on steroid injections, specifically into the lumbar region or into the spine. One of the main reasons for using this is to help with pain in the neck, the arms, the legs, and the lower back caused by pressure that is applied to the spinal nerve from inflammation that's going on in that area. What they do is they mix a local anesthetic, usually xylocaine or bupivacaine, which helps to take away pain right away from the area, as well as a steroid, which takes a little longer to work. With that, when you get the injection, right away you will feel pressure at the site as the injection's occurring. Most of the time you're not going to feel pain, but you will feel an increased pressure there. Side effects that you'll have to deal with will be pain at the injection site. You are getting a shot. You may get a rash at the injection site as well. It can increase your blood pressure in some people, but one thing that you will generally see because you're getting a steroid is it can increase your blood sugars. So be aware of that, especially if you're a diabetic patient. You can see a rash. You can also see nausea, vomiting, general malaise type feeling, kind of like you got the flu. Some people will experience insomnia as well, and you may also see edema or swelling, specifically in your ankles and your feet too. The effects of it, for some people, it can last just a couple of weeks. For others, it may last up to a year from just one shot. Generally, for the most part, people will experience pain relief from 3 weeks to up to 3 months. As the steroid slowly dissipates and absorbs in the body, that will determine the length of time that the pain relief will occur. You don't want to do more than 3 of the injections in a year, mainly due to side effects, and the more that you do, the less results you typically will get. Your body just kind of gets accustomed to it, so it will not respond like it normally does. If you get a lot of these injections, you can be subjected to thinning of the skin as well as weakening of the bones. So if you can get away with 1 or 2 a year, it's better for you in the long run. You also want to remember it's not a cure, it's just a treatment. And it won't work for everybody. But whether it does work for you or not, it is important to remember you need to do some things on your own, such as weight loss, exercise, especially if you're having a lot of pain, mild exercise will still do the trick. And options like physical therapy and occupational therapy are also very good things to consider to help you work through that. The other thing that can occur if you do a lot more than more than 3 injections in a year, you might want to look at a procedure that's minimally invasive. It's called a lumbar decompression. And what they do is they do a small incision along the spine, and it helps to relieve some of that pressure that the steroid injections are also doing. But you're not actually getting an injection. It's just a small incision. There's no drug inserted, and that can also relieve some of the pressure. So hopefully this has answered some of your questions regarding spinal injections, as well as maybe calm some fears that you had. Last thing I want to leave you with, if you are on any antiplatelet or antithrombotic medications, meaning those drugs that keep your blood thin, like Eliquis, Xarelto, warfarin, clopidogrel, Pradaxa, even aspirin, just to name some of those. Make sure you talk to your provider about it before you get the injection, because they want to know about that, and it may disqualify you from it, but talk to them and let them know.